gentlemen. I'm Lucretia B. Tato from the second year physiotherapy class, and I'll be presenting on the topic today transdermal drugs under the course of pharmacology. So, first of all, I want us to know what is transdermal drugs administration. It's a delivery of drugs across the skin into systematic circulation using formulation applied to the skin surface. So this drug is used to circulate the uses of formula through applying it to the skin surface. You have to apply it to the skin surface, then it will dissolve within the skin and then work. So designed to provide control absorption while minimizing invasive procedure. So while applying these drugs on the skin surface, it is designed to provide and to control absorption. So it's designed to provide and control absorption while minimizing invasive procedure. So in minimizing invasive procedure within the skin. So one one of these procedure we are talking about is one non-invasive topical application that reaches systematic targets. So one of these disruption it reaches or it apply to reach systematic target. When we talk about systematic target, we talk about those or system that is within the body. Yes. So two, we talk about the uses skin as a root. How does it use skin as a root? Not oral or injectable. It just use the skin surface as a root to minister these drugs. And then three, often formulate to control rate and duration of delivery. So you see, this drugs is also formulated to control rate and duration of delivery. Like it is important also to the rate and duration of delivery, which means the time. And then when we talk about rate, we talk about how the delivery is. And then when we talk about duration, we talk about the time indefinite, how it affects or how it impacts the delivery. So this is my diagram showing how this drug is applied or how it transform itself within the skin or in those systems that is needed. So it is how we apply this drug on the skin surface from my diagram or from my image. Why choosing the transdermal route? Why are we choosing transdermal route? One, to avoid first pass metabolism. How do we avoid first pass metabolism? By bypassing hepatic or degradation, and then for improving bioavailability. What are those bioavailability? Availability is those things, those organ that is this or pathogen that is there to affect our skin, but this drugs is actually there to administer with in a skin surface and then passes to the systematic formulation within our body. And then we have two, to improve hearing adherence to improve adherence. Simple application. We use pitch or gel. We use pinch of gel or gel, increase patient compliance. So this application that we use, which is the pitch or gel, it increases patient compliance. So we have three. Sustain release. How do we sustain release? Spread plasma level over hours to days. So we spread plasma level over hours to days, fewer doses needed. So few when it's talk about fewer doses, we talk about just few doses needed to do this procedure. Then we talk about reduce systematic parts. How do we reduce systematic parts in this drug? So lower pack to talk, variability, reduce side effect. So variability will reduce side effect, and then lower pack to talk. Then we talk about the steps of transdermal system. Those steps are: one, pH metering or resolver. Then under this pH metering and resolver, it most common provide control release via a herbs system. Then we talk about gel. Good for flexible application error, fast onset for local or systematic infect. So this gel is also used for localized error and then systematic infect, which means if you apply on localized error, which is the surface of the skin, and it has some impact in our system also, not just applying it with on the skin, but it has some impact within our system also, that it works. Then we talk about the cream and the ointments of these drugs. In the cream and the ointment, we are often used for local therapy or to enhance skin hydration and cremation. When we talk about skin hydration, what are we talking about? We are talking about that identical medication that is working on the skin. It hydrate the skin, which means it make the skin suitable. It make the skin stable. It make that dross to hydrate. When something is hydrating, it's like penetrating through the skin, working through the skin. So then we talk about the micro needle and system. In-her system. So in the micro needle and in-her system, it creates transient macro or channels for larger molecules and vaccines. So these micro needles, it creates macro channels. What are those macro channels? Macro channels are those channels that is within the body, within the tissue. Macro channels, like it derive from these macro needles, it help impart healing within the tissue. So it also have this medication within this needle to help heal the system, penetrate through the skin to the system to work. Then or for larger molecule and vaccines. Then we have here the passive diffusion, epithelial route, and system transport. This diagram summarizes how molecules cross skin. Most drugs rely on passive diffusion across the skin condoms. Some use epithelial a jailed paths and advanced systems employ physical or chemical enhancement to increase flow. So we'll talk about the factors influencing drugs prevention. Those factors that influencing. When we talk about influence, which means when you say factors influencing drugs prevention, drugs property, molecule weight, molecular weight, lopo, lipophilicity, inostation melting points, formulation, solvents, penetration, inheritance, ad- adherence, resolver designs. So three, we talk about the skin condition and sight, hydration, integrated, thickness, hair density. Then we talk about the application factors, dose area, occlusion, contact time, temperature. And we talk about the similar moderately lip, lipoclean molecules, typically cremates best. Micro needles, Brunette possibilities for larger molecules. And now we are going to talk about the importance in modern medicine. So, the importance in modern medicine, which is one pain management, upload and non-upload patches for chronic pain control with spread with standard dosing. Hormone therapy. When we talk about hormone therapy, we talk about the hormones within the human body. Ostration, progestin patches for contrast, contraception and menopause symptoms. Then we talk about smoking, cessation, nicotine patches deliver control nicotine to produce withdrawal. Other uses are motion sickness, vascular conditions, and emerging vaccine or biological delivery. So this is the photos that is showing how these drugs and the position in which these drugs is applied. And we'll talk about the advantages and disadvantages of these drugs. Non so in the advantage we have the non-invasive, it improves harassance, studied plasma level, evolve first pass metabolism, reduce systematic peak, fewer side effects, convicted, and then dosing schedules. Weight advantage versus limitation when selecting this route for therapy. Disadvantage: limited to suitable drugs, variable skin, absorption potential for irritation and sensation. Those limits: error-based, complex formulation developments, removal or adhesion issue. So one of the case study of this is a nicotine patch. The nicotine patch is a established transdermal therapy for smoking cessation. It delivers controlled nicotine over 16 to 24 hours to reduce craving and withdrawal symptoms. Formulation advance at harvest formulation at harvest matching with drugs needed for constant flow. Benefits: improve quit rates, simple application, dose stopping via patch strength. Considerations: local skin reaction, correct site rotation, not suitable for all patients. It's not suitable for all patients. Future of transdermal delivery. So talk about the future of transdermal delivery. Emerging technologies promise to expand transdermal scope beyond small molecules. So one, we have the macroneedles and macro array system. It enables delivery to penetrate vaccine and large bowel locus with minimal invest, invasiveness. invasiveness. Smart patch, closed loop system with sensor and control release via electrons or responsive polymers. Novel enhancer and formulation. Chemical enhancer like lipid carriers and nanopathogen particle and nanoparticles to improve flow and specificity. Trust. So I want you to take away this one line of paragraph of transdermatic drugs, root of drugs. So take away transdermal delivery is evolving from simple patches to integrate platform that broadens therapeutic possibilities. So I want to thank you all for watching. Thank you. Thank you. Bye.